Hello, and thank you for joining this Healthcare Analytics News peer exchange titled, Can Outside Disruption Save Healthcare? We could not have picked a better time to hold this discussion, as Amazon has officially entered the digital pharmacy space through its acquisition of PillPack. Google, Apple, Uber, and lots of other Silicon Valley all-stars are also focusing on healthcare with the goal of targeting the complex problems that the healthcare industry has been unable to solve on its own. Today, we'll discuss which areas are ripe for change, which tech companies are doing the disrupting and how they're doing it, and what it all means for healthcare organizations. Most importantly, what does it mean for patients? I'm Dr. Kevin Campbell, and I'm a Duke-trained cardiologist. I'm the CEO of Pacemate. I'm an on-air medical expert for local and national TV news, and a proud member of the Healthcare Analytics News Editorial Advisory Board. Participating today on our distinguished panel are Colin Hung, who is the Chief Marketing Officer and editor of HealthcareScene.com and founder and host of the Healthcare Leadership online community, better known as HCLDR. We also have Dr. Geeta Nair, Chief Healthcare and Innovation Officer for Fernwell Group Health, and is a nationally recognized leader in healthcare information technology. She has been named one of the top 26 smartest people in health IT by Becker's Report, and I can attest to that. We also have John Nasta, President and founder of Nasta Lab, faculty member of Singularity University, member of the Google Health Advisory Board, a member of MYOS Corporation's Board of Directors, senior editor and editorial board member for Lifestyle Medicine Journal, and a contributor to both Forbes and Psychology Today. We're also joined by Jane Sarasin-Khan, who is a health economist and advisor for Think Health. She's a blogger for Health Populi, contributor to the Huffington Post, and a member of several healthcare company advisory boards. Again, thank you so much for joining us today. Let's dive right in. So, Geeta, it's my hope, let me ask you the first question. It's the hope of many that outside disruptors will enter healthcare and solve its problems, which, these are widely varying problems, and depending on which expert you ask, you're going to get a different answer. What specific issues in the industry do you consider ripe for this sort of disruption, and why?
Sure. Well, Kevin, first, thanks so much for having me on. In my mind, there's actually only one, and it's about access. Whether it is getting the consumer more access to their doctor online or in person, whether it's getting them access to low-cost pharmaceuticals in person or online, it is all about connecting the patient with the doctor, period.
I think those are very important points. John, what do you think about?
Geeta, you can guess what I'm going to say. I disagree with you 100%, because if I'm a patient with a rare cancer or a particular clinical scenario, I want the technology first, because access without technology is no good. So I think it might be a little bit of a double-edged sword, but I'm reminded of things like immuno-oncology. The magic of personalized cancer therapy is really a function of the personalized science and not the personalized access. So I guess maybe it's a bit of two sides of the same coin, but I think that the magic lives with the science and the technology.
I agree with you. I actually don't disagree with you, but the technology is what's going to help us expand the access, right? So it's not that I want technology. I don't go to the doctor because I want technology. I go to the doctor because I want access and the solution to my problem. If technology helps me, I'm there, but I'm not going to the doctor for the technology. No way, no how.
Now, I would add, I think you're both right. And the reason I do is because I think, just as Geeta just said, technology provides access. Perfect example. I went to the South Pacific last summer to provide medical care to a remote population, and I took an AliveCore ECG device and did an EKG on every patient. I engaged those patients. They understood what a heart rhythm was. They understood their heart had electrical activity, and they wanted to make sure they were okay. So we granted access through technology. Jane, what do you think about this whole role?
So I think I have some glue that can do the kumbaya. And when I look at the nature of this question, which is what can outside disruptors do to help us solve the intractable problems we have, it's that I'm a health economist, so I think about waste. We are so fragmented, in especially U.S. healthcare. The patient that John's talking about who may not have access to a particular cure because it's somewhere else, their doctor doesn't know about it, or what Geeta's talking about in terms of physical access, logistical access, literacy access. If we look to defragment the industry the way, say, Amazon has streamlined an encounter, or Iora Health in healthcare has brought social determinants of health together with a resilient IT infrastructure, we start to defragment and make the patient journey and access to care this wonderful, serve it up really where it needs to be at the right time, as you served up the AliveCore just in time to your population. So for me, it's the fragmentation that really gets to me.
The glue that sticks it all together. Colin, I want to hear your thoughts. I mean, I know you're from Canada, so you have a little bit different perspective than what we have here in the United States.
Yes, I come from the land of socialist healthcare, but where wait times are actually not as long as everyone thinks. I'm still alive, yeah, I take my pulse. Yeah.
Are you on a waiting list for a pacemaker?
I am not. No, I actually, when I saw this question, I actually looked at a very different aspect of healthcare. For me, what's ripe for disruption is education. The medical education, I think if you start there, you can have lasting change. I mean, I look at how we teach our physicians, how we teach nurses. It's, from the 1960s, the approaches that they take. Now, there's been some changes, but for me, I would love to see more incorporation of the latest in technology, figuring out how to incorporate that technology into something as simple as the visit. And then also, of course, the analytics side. Like, actually, how can we help these physicians and clinicians to interpret this mountain of data that they're now faced with? I don't think a lot of the traditional teachings, the way we've taught, allow people to effectively look at that data.